Hi guys, my name is Aymara and I am now a 4th year medical student, and in today's video I'll be showing you what surgery is like as a medical student. This week was actually really exciting as it involved urology and breast clinics, as well as prescribing sessions and the very fast-paced surgical admissions unit. So this morning I was at the Nottingham Breast Institute, which was actually a pretty hands-on clinic, if you excuse the pun. In this clinic I carried out 3 breast examinations under the supervision of the nurse. 2 were completely normal and 1 there was actually Paget's disease of the nipple, as well as some signs of malignancy in the lymph nodes of the axilla. I then got to see some of these patients go through and have their mammograms, have their ultrasounds, which was really interesting. And bear in mind that my patients varied from 30 years old to 99 years old, so it just shows how important it is for ladies of all age to check your breasts. So I'm currently in a staff common room, just doing a bit of admin, doing my logbook, doing my end of attachment reflection. You'll find that as a medical student you have to do a lot of this just admin stuff. Then I had a urology clinic with an incredible doctor who actually took the time to answer my questions and talk through the patients in depth. But in this clinic I actually saw a lot of renal cancer, and I had to see the doctor give a terminal cancer diagnosis to a relatively young unsuspecting man, which was one of the most traumatizing events I've had at medical school. I think it was so shocking to be part of such an intimate experience. And yeah, it was a very sad moment, but the doctor handled it extremely well. So the next morning I had to wake up very early to then do a 1-hour long commute to the hospital to be in theatres by 8:30 a.m. Anyway, I then managed to pluck up the courage to ask to get scrubbed in because I desperately needed to get this signed off. However, I don't know if everyone else realised this, but I didn't realise that getting scrubbed in, surgeons expect you to be involved in the surgery. And this may be absolutely wonderful if you're keen on surgery, but if you're like me, it can be a little intimidating. But I did manage to actually hold some of the breast tissue during the surgery for the surgeons and help cut the sutures at the end, which I did actually get a little nervous doing and mess up a few times. I mean, how does someone get cutting a string wrong? Somehow I managed to, but it was fine in the end, a really good learning experience. And actually, the 2 surgeons, they were both really patient and lovely with me. So right now it is around 8:45 and I'm just about to leave to cycle to my prescribing lesson. So these are basically an hour-and-a-half sessions with a pharmacist who basically goes through prescribing through different difficult scenarios. For example, last week we did prescribing perioperatively, so thinking about drugs the patient can't take before surgery, as well as drugs that the patient's going to need to take post-surgery, such as analgesia, etc. So yeah, I'm quite excited because, as many of you will know, pharmacology is my favourite part of medicine. So hopefully it won't be too bad. Now, I thought I loved pharmacology until I got to the prescribing session and the pharmacist threw loads of complicated IV fluid calculations. I actually think in this prescribing session I prescribed someone 1,000 times more morphine than they should have had. Obviously this was a fake patient and a fake drug chart, but I think I gave them something like 4 grams of morphine when I was meant to give them only 4 milligrams. In order to get me through this, I'm gonna make my specialty, which is a slushy Red Bull watermelon, because I will need to study today for a long time, and I'm so burnt out. It's the last week of term. I go on holiday this Saturday. You know when you start getting into the holiday mode? So right now I'm doing some Anki on conditions that I think I'm most likely to see in the next coming few days. So I'm going to be based on the surgical admissions unit, which is anyone who's basically having a surgery, whether it's elective or emergency. They come in through there, have their history taken, baseline bloods, etc. So it'll be a very exciting opportunity, but I feel very ill prepared. This week we're learning all about abdominal pain, jaundice, things like gallstones. So I'm trying to avoid gallstones because I feel like that's definitely something that's going to come up tomorrow. Motivation is genuinely at an all-time low. I don't think I've ever found it this hard to study. It is 30 degrees, which in the UK with no air conditioning is awful. It's the last week of summer. But hopefully for you guys watching me, it'll be easier to do. So yeah, let's do some Anki. Let's aim to, by the time it gets around to 7 o'clock, so in an hour and a half, have finished everything to do with gallstones. I'll be a gallstones expert. Wish me luck. So the way I've been revising during surgery and actually throughout my time on placement, whether it's been ENT, ophthalmology, psychiatry, now GP, is I make Anki cards using online resources like Zero to Finals, the resources given by my university, as well as resources made by students in older years, and then I make Anki cards out of these cards and then find time to do them every so often. However, I'm not gonna lie, it is very hard managing making Anki cards as well as doing them, and it's definitely not a balance I've gotten right, and I keep trying to refine this process. But sometimes I actually do surprise myself and know facts and conditions that I didn't think I knew, but I like come out with the answer like during clinic or something, which, so, you know, it might be working a little bit. In case you haven't noticed, I am really not a morning person, so if you've clicked on this vlog to find some like medical school, just general motivation, then at this hour I can't give that to you. So what time is it? Oh my god, I have to sleep in 15 minutes. SAU, I'm there from about 7:45 till midday. It's gonna be intense, hopefully fun, hopefully hands-on. Hopefully I can carry out some clinical skills like, I don't know, bloods, cannulas, maybe even something like a catheter. Fingers crossed. It is a good learning opportunity. It's just so scary being a medical student because you're kind of like begging all the doctors to give you the opportunity to carry out these skills, and they're very reluctant to because they'll have to teach you and guide you through it, which is kind of a waste of time to them when they can do it themselves. And then when they finally do give you that opportunity, you just are so unconfident and you don't really know what you're doing that they're like, were you so keen on me letting you do it? But that's how you learn. Yeah, so now I've got to make lunch and breakfast, which is so stressful to make 2 meals, consume one of them in 15 minutes, but here we go. This is my soul bowl, isn't it so cute? We've got some chicken, chimichurri, salad. So it's going really well. I have clerked 2 patients, which is taking a history and 2 abdo exams, and I have presented both my cases, and I was actually really happy with how that went. So far, but quite interesting actually. Get to see a good range of cases, which means that you can kind of revise elements from different parts of surgery all at once. Want to get some bloods and cannulas and hopefully some IV infusions just to get those signed off, because I definitely need practice, especially after my embarrassingly stick injury that happened recently. I definitely need more practice. Today, ladies and gentlemen, is the last day of 3rd year and my last day on surgery, so very big day. Holly keeps saying like, don't worry, like keep going, it's like your last day, you know, it's exciting, you're at the finish line. Well, I'm not, because I haven't even finished covering this week's content. Like, it's been so hard to manage going in basically all day and having to revise everything that could go wrong with the abdomen. I'm actually so late. I'm meant to be at the hospital now. Like, you don't understand, like, that is my worst flaw, but for some reason I don't really do anything about it. Okay, I need to go. I'll see you later. Got to actually help drain an abscess. By help, I literally mean just giving the surgeon the gauze and then like getting all the fluids and equipment that she needed, but still, it was pretty cool. And then I had the most traumatic experience taking bloods. So halfway through taking bloods, the phlebotomist decides to completely change the method that I'm using to one that I've never heard of before. They ended up fainting throughout this like faff. Then the couple got really mad at me and said, I don't want you in the room. And then I literally ran out of the hospital crying, anxious, feeling completely useless and incompetent, and like, why is it that I'm the only one in my course that's only managed to take blood successfully once? How have I managed to make a patient faint and get a needle stick injury? The reason I'm telling this story is because if you ever feel completely incompetent, and if you ever feel like, how come no one else in my course probably has it this hard? I'm the only one that's, you know, failing or behind. Everyone else is probably, you know, acing it. Well, you've just heard an absolute nightmare story, so I guess that's proof that it's not just you that has it hard. Anyway, to sum up, yes, surgery had its interesting moments, for sure, but it's not for me. I'm happy to let the medical students who are interested in surgery battle out for the few surgical training spots that there are, while I'm in the corner happily taking my psychiatric histories and prescribing drugs. If you want to see what my psychiatry placement was like, then I suggest that you click up here. I will be making a whole series of the different rotations I have at medical school, so stay tuned. You will be seeing a GP one very shortly.